It is a huge honor today to be interviewing Fred Margolis, who is lives in Chicago, and he's probably pretty excited right now because this is June 3rd, and tonight is the first game of the Stanley Cup playoffs with your Chicago Blackhawks and the Tampa Bay. Is it Tampa Bay Lightning?
I'm not sure, Howard.
No, it's Tampa Bay. But so are you going to watch the game tonight?
Absolutely.
I'm watching it with two dentists, Tom Mattern and Tim Taylor. We're pretty excited. Tom's from Chicago. He's a big hockey fan. But, you know, Fred, what's most interesting about you and why I wanted to get you on here so much is I love your passion. I mean, you have an incredibly amazing history, but I never thought of lasers and pediatric dentistry. And you're a pediatric dentist and you're into lasers. And that is just, I mean, you might be the only guy I think I've ever heard of, let alone met or interviewed, who's big into lasers and is a pediatric dentist. I don't know if a single pediatric dentist has a laser. So how did all that happen?
Well, back in the year 2000, I was reading Dental Products Report, and they were talking about the erbium laser for hard tissue and soft tissue, cavity preparations, and gingival surgery and so forth. So I called three friends of mine. I called Dennis Petrini, who at that time, general dentist, who at that time was the president of the Academy of Laser Dentistry. And I said, is it time for a pediatric dentist to get involved in lasers? And he said, Fred, it's a perfect time because the erbium laser can do both hard tissue cavity preparation and soft tissue surgery. So then I called Bob Pick, periodontist, and past president of the Academy of Laser Dentistry, and he's used a CO2 laser for many years on several of my patients that had dilatant hyperplasia, and he's been able to remove the excessive growth of the tissue with his CO2 laser. And I said, Bob, you and Leo Meserodino wrote the book in 1995. It's the first book that I know of that talks about lasers that are approved by the Food and Drug Administration. And there were only two little paragraphs about the erbium laser. Why? Because the erbium laser wasn't approved by the FDA till 1997. And then he said, I think it's a perfect time for a pediatric dentist now that the erbium lasers are out. So I called a third friend of mine, Harvey Wigdor from Chicago. And Harvey had been doing research, general dentist, been doing research on lasers for over 20 years. And facetiously, he said to me, Fred, I think you should wait another 20 years till I perfected the CO2 laser where it's not going to burn up the pulp. Well, we're very fortunate that a year and a half ago, a company called Convergent Dental came out with a Soleil laser, which is a 9.3 microns, which doesn't mean anything to you and I, except that from the physics, it will prepare hard and soft tissue and not burn up the pulp. The other thing I wanted is, you know, several of the articles that you may have seen that I've written have to do with local anesthesia and different types of techniques. For example, the STA program, STA technique, computerized, the Parajet, and so forth. Well, with the laser, I can numb a tooth in 30 seconds. No numb feeling for that patient. Now, that's really important for my pedo patients because you can tell those patients and my special needs adults, you can tell them 100 times not to bite their lip or tongue, and what happens? The next day they'll call your office, right? And say, gee, Johnny's lip is a little swollen, you know, and that's the side you gave him the local anesthetic on. So from that aspect itself, then I was giving a lecture for the World Clinic Laser Institute out in Huntington Beach, California. And this is about probably 7 years ago, with a dentist from Italy named Giovanni Olivi. He's a general dentist. His wife, Maria Daniela Genovese, is a pediatric dentist. They practice together in Rome. And after the lecture, Giovanni put his arm around me and said, Fred, let's write a book on lasers. So 3 years ago, Quintessence published our book. It's the first book on pediatric laser Dentistry. It's a textbook used now by many schools that have laser programs, including a friend of mine started teaching in South Africa, in Johannesburg. After I gave a lecture in Cape Town and Johannesburg, he's a pediatric dentist and got very excited about laser dentistry. So those are some of the things. Now in 2000 we got our first laser. My partner at the time and I only overlapped our practice 1.5 days a week. And yet by the second year, we bought our second laser. It was an erbium laser also. Now, erbium lasers, Howard, is a specific type of laser that can go ahead and, again, prepare cavities, numb the tooth. We call it laser analgesia, and also soft tissue. And I wanted to answer your question about pediatric dentists and involvement in laser dentistry. Larry Cotlow and I, this will be our 5th year in a row, that we've lectured at the Academy of Laser Dentistry and given an all-day program. Sometimes we have other pediatric and general dentists who lecture that day on pediatric and orthodontic use of lasers. And then the second day, we do a hands-on clinic. The last 2 years, our hands-on program, the workshops were sold out. And what's nice about the Academy of Laser Dentistry is they have lasers there from around the world. Some are not even approved yet by the FDA, but we get to try them, our new toys. You know how dentists are with their toys. We get to try them out, see which ones will fit best into our practice, and decide based on the cost and based on the return on investment, which one we should get for our practice. And by the way, I want to tell you that I just ordered, 5 minutes before we got online, I just ordered 2 of your books. This is my order form. I'm going to give my associate one, and I'm going to take the other one. And it's got rave reviews, and I really appreciate the work that you do.
Oh, thank you. That was an thank you very much for that. And that was an amazing introduction. So a couple of things that you said, and I'm trying to guess questions for viewers. These podcasts usually listen to 5,000 people around the world. When you talk about FDA approval, okay, you're an American, you practice in Chicago. Does a dentist in Johannesburg, South Africa, or Rome, should they really care or not whether a laser is FDA approved in the United States? Is that just a regional political thing, or is that really an endorsement of saying this is a good technology? I mean, should a dentist in South Africa wait for an FDA approval of a laser in America?
I don't think so. And the reason for it is because I've learned in recent months that the FDA, what they're approving is the marketing. In other words, you can't say this laser will do this, that, and the other thing unless you can prove it. So that doesn't mean that in Europe, when they used to sell a laser that eventually came to the United States, but it started out in Europe. They've had lasers, they've had erbium lasers for years in Asia that we couldn't buy in the United States because it didn't have FDA approval. Let me give you a perfect example of that. I was sitting on a bus on the American Academy of Pediatric Dentistry's meeting, going to a dinner dance. Sitting next to me happened to be a businessman who owned a company that makes fluoride varnish. So I said to him, now I know fluoride varnish, we use it off-label for preventing caries because it was really invented for hypersensitivity, as you know. I said, you're never going to take out a patent on fluoride varnish, are you? And he says, why should I spend $3 million on a patent if it's already the standard of care? So maybe that's a poor analogy, but
no, that's a very good analogy because what is Ivoclar's? They have a fluoride chlorhexidine varnish. Do you know the name of that?
I don't remember offhand.
Everyone in Germany and Liechtenstein in Europe, it's huge, and people apply it every 3 months, and it reduces decay and all that kind of stuff. But yeah, they can't say that in the United States. Leanne Brady here in Arizona, she uses that and swears by it. But you're right, it would be bloody expensive for Ivoclar to try to get that a claim like that approved. So for our viewers, you're throwing around the word erbium. Talk about what is the difference between an erbium laser and a carbon dioxide, a CO2 laser, and other types of lasers. And probably the most popular sold laser is the ADM laser, the for soft tissue. So
Right.
explain, give us a laser tutorial.
Absolutely. Right now, the top three types of lasers, according to wavelength in the United States, would be a diode, which is soft tissue only. Now, they have diodes, okay? They have diodes this big, Howard, or this small, if you will, that are pocket. You can go from operatory to operatory. And they have diodes that are about as big as a toaster oven, okay? And everywhere in between. So the diode laser, there are two types of fibers with the diode. One is a fiber that you cleave the fiber, like when we were back in chemistry class in high school and you had to score it and cleave it. Well, that type of fiber. And then there are others that I like even better that are disposable tips. So the assistant and or you don't have to take the time between patients and cleave them. Now, advantages and disadvantages to either. One is the cost is less expensive if you don't have the disposable tips and if you're cleaving the long 4-foot long fiber. So what do those lasers do? You're a general dentist, correct?
Correct.
Okay. And it'll work for troughing. It'll do gingivectomies, diode lasers. It'll do frenectomies, any soft tissue work. It'll also, in over 35 states, and I want to point this out, that in over 35 states now, hygienists are allowed to do non-surgical periodontal treatment. So after scaling and curettage, the hygienist or dentist goes in and makes sure that the bacteria are killed. See, the laser kills 90+% of the bacteria. So let's go on to the next type of laser, which is the erbium, according to wavelength. Now, there are two wavelengths of erbium laser. BioLase has I guess it would be a patent on a laser that's a 2780 nanometer laser. And the other erbium lasers, erbium YAG they're called, are 2940. The difference to you and I is minimal. They both cut hard tissue, soft tissue. I saw a general dentist via video at a meeting. He showed how he did a torus removal with the erbium laser, how another dentist did an apicoectomy. Now this is, of course, he used anesthetic to make the flap, but he did the apical as far as removal of the bone and getting down to the root tip with the erbium laser. About 2 years ago, Convergent Dental came out with the Solea, which is a 9.3 micron laser. The Solea is the first laser in the world that will do hard tissue and soft tissue without burning up the pulp. What's the advantage? It's faster than the erbium on soft tissue, and it's faster on hard tissue. You cannot remove any amalgam directly with the laser. So what I do is I take the laser and either the erbium or the CO2, and I perform laser analgesia, and then we go ahead, take the high-speed drill, cut out the old amalgam, the tooth's numb already, from the laser analgesia, go back to the tooth and finish the prep with either the laser, and 75% of the time, I'm going ahead and picking up a handpiece and getting the contours I want and so forth, but the patient's numb. Can I give an example of the laser use in children?
Absolutely.
I'd like to tell about this anecdote. I went to a dinner meeting sponsored by one of the laser companies, and I wasn't the speaker, but being the very introverted person I am, I went around the room and introduced myself to the 12 dentists that were there. 2 days later, I get a call from Dr. John. Dr. John says, Fred, I just met you 2 days ago, but I have a patient, an 8-year-old in my chair, that needs a root canal on tooth number 3. That's the upper right first permanent molar. And he said, her knees are shaking, and I really don't want her to be in any pain. And I heard you talk, and I heard the lecture about the laser. I was wondering if you could see the patient. I said, send her on over, and I don't do molar root canals, but we can get her out of pain, do a pulpotomy, and refer her to the endodontist. So she came in with her father, who brought the x-ray. And I explained that to her daughter, to his daughter, and to the father, that we were going to use a laser, which will allow me to go ahead and prepare the tooth, remove the decay, and get her comfortable. And Jenny, if you have any problems, any discomfort, I want you to raise your left hand. I said, Dad, I don't have enough laser glasses for everyone. You'll have to wait out in the reception room. You like that one, Howard? Yeah, that works. So, in any case, so when Mom brought the rest of the x-rays and Mom and Dad came into the operatory, I had gone ahead with the erbium laser, prepared the tooth, gone into the pulp, did my pulpotomy. She never raised her hand once. Mom and Dad, and this was a hot tooth, Mom and Dad came into the room and said, Jenny, how was it? And she said, it was fun. Now, I don't know how many of your patients, but most of us, we have patients that have hot teeth, either primary or permanent, and it's not so much fun. So in any case, that's a good case in point. I like it for my autistic patients, as I mentioned, because the tooth is numb, but they don't have that numb feeling. I used it on my wife. I used it on my sons. And, you know, if I could use it on my wife and she'll still let me stay in the house, I think that's great, you know. And she swears that she didn't feel anything.
So is this syringe solely a laser made by Convergent? Is that out of Utah? Because it seems like going back in the day, I mean, I got to school in 87, that most of the laser companies came out of Utah because Salt Lake had a physics laser instructor, and he was kind of the American, that was the hotbed of lasers.
Right. They're out of Massachusetts.
They're out of Massachusetts?
Yes.
Because it seems like every time I meet a laser scientist, his teacher was from Salt Lake.
Yeah, that could be.
Yeah. Okay. And how much would that Soleil laser be? How much would something like that cost?
I don't like to quote prices, okay, but I will say that the erbium and the CO2 lasers, the CO2, the Soleil, are much more expensive than a diode. So, you know Barry Freiberg.
Absolutely.
Okay, Barry and I were partners at one time when I first got out of school.
I'm in Phoenix. He has a retirement home in Scottsdale.
That's right, exactly. So I called up Barry one time and I said, Barry, I'm setting up a new office. Which computer should I buy? And he said, what do you want to do with it? And when people email me or call me and say, Fred, which laser should I buy? What do you want to do with it? If it's soft tissue only, then you buy a diode. Now, getting back to diodes for a second, if you wanted to do hard tissue and soft tissue, then you buy the erbium or the CO2. But getting back to diodes, so you can spend $2,000, you can spend $10,000. What's the difference? They have a laser. In fact, I have one in my practice that's made by Photona. It's called the 1064. 1064 nanometers is the same wavelength as an Nd:YAG. Now, Nd:YAGs are still used. It's for soft tissue only, but they're more expensive and they're as large as a CO2 or an erbium laser. So most people are going to the smaller size so they can carry it from operatory to operatory. The other thing is the less expensive diode lasers, like the pen size, everything has advantages and disadvantages, right? Okay, the advantage is it's pen size, you take it from operatory to operatory. The disadvantage is because of the maximum wattage that comes out the end, it's much slower than some of the other diodes. So there are quite a few companies that make diode lasers and market them and sell them in the United States. And I was going to say this at the end, but if anyone wants to contact me by email or phone, I'll be glad to help them with any decision making or any suggestions. I can actually send them setups as far as what they should have their laser on, like how many watts and how much water to use for different procedures. So it's all in my textbook, Pediatric Laser Dentistry by Quintessence, but I'll be glad to send them a little PDF of that section.
And how would they comment? How would they contact you? Would you willing to give out your email or phone on the podcast?
Sure. Yeah, my email is KID, Z as in zebra, DR, like kids doctor, at comcast.net. And I have my own teaching institute, and that website is dentaledorg, dentaled.org. And we do offer free webcasts, by the way, once a month. We started that last year. So I'm very proud of the programs. We've had 6 different speakers.
You should start a thread on Dentaltown about that. We're coming up on 200,000 members. We're at 198,900 now. And from every country on earth, and we have 52 forums, root canals, fillings, crowns, pediatric dentistry, and one of them is lasers. And you should start a forum and post a link to how to order your book and your website and your institute. And you should really do that. I think that'd be amazing marketing for you.
Well, thank you. That's very generous of you.
Yeah. And so what's interesting, what I'm hearing you say a lot is that what really got you the most excited about lasers and pediatric dentistry was the anesthesia, the analgesia effect. Right. Can you explain, how does a laser numb a tooth? Do they even know?
Good question. In 2001, I went to my first Academy of Laser Dentistry meeting, and they had researchers from all around the world. And at the end of the day, you got to ask them questions. The panel of specialists got to ask questions about lasers. And I said, how does the laser numb the tooth? And they looked at each other and said, we don't know. There are 2 theories. One is that there's a ionic transfer, sodium-potassium transfer at the pulpal level that blocks the sensory innervation. The other most common theory is the gate theory, where the laser somehow at the pulpal level blocks the sensory innervation from the tooth to the brain. And it reminds me of the story, Howard, that when I came back from that presentation in 2001, I said to our oral surgeon, we had a group practice at the time, I said, Ken, I'm really nervous. They don't know how the laser numbs the tooth. He says, Fred, we've been using nitrous oxide for 150 years? We don't know how it works. We've been using general anesthesia for years. We don't know how it works. I said, oh, okay, well, I feel better. And in fact, he says, I'm going to refer all the frenectomies to you. And I said, why? And he says, because you have a laser, you're getting less bleeding and faster healing. Now, the reason we get faster healing from a physics point of view is because if the tissue is here and you take the laser, the depth of penetration is much less than an electroknife or electrosurge. And that's why when Gordon Christensen, I've lectured with him and I've lectured for him. And I was his host when he came to Chicago one time for one of my volunteer programs, Dental Volunteers for Israel. And Gordon stood up and he's talking about lasers. And this was 8-9 years ago. And he said, you don't have to buy a laser. You can go out and buy an electroknife or an electrosurge. It'll do the same thing. Well, it will do the same thing. But the charring you get, right? From the
oh, yeah.
Yeah. Well, when you get charring with a laser, that means your wattage was too high. It won't hurt the patient, but it's slower healing. I mean, we get incredible results. I take care of babies that are 2 days old, 3 days old. Larry Kotlow, that I teach with from New York, there are several masters in the world in laser dentistry, and he and I are two of them. And I'm proud to say we got the Leon Goldman Award last year from the Academy of Laser Dentistry for clinical excellence. So that really made me very, very pleased. But in any case, so we're training dentists throughout the world that come to this Academy meeting and also to local meetings. I was just in Cleveland talking to the Alpha Omega group there. I visited several universities and certified. I'm fortunate that I'm one of 20-some dentists in the United States that can certify other dentists in lasers. And I certified lasers at Nova University, Michigan State, University of Illinois, Detroit Children's Hospital, and I'm going to Mott Children's Hospital in Flint, Michigan in a couple months. So this is my legacy. If I can teach, and you'll agree with this, if I can teach someone how to do something better, I mean, this is what I feel. Let's get to the bottom line. That's what this is all about, right? Is teaching our colleagues that, gee, maybe there's a better way to do it, a faster way, easier, and more comfortable for the patient.
Well, you should create an online course on Dentaltown or a series of courses, because we just put up our 307th course, and we just passed 500,000 views. So if you put up your laser course, whether it be an hour or a full curriculum or a full series or whatever, I could guarantee you that dentists from every single country on earth would be watching it, from here to Kathmandu to Tanzania to Ethiopia to everywhere.
Well, thank you. And after this podcast, if you wouldn't mind, email me the information of who to get in touch with to get that started.
Yeah, his name, I'll email to you. His name is Howard Goldstein. He's a dentist in Bethlehem, Pennsylvania. And his email is Hogo, because I'm Howard and he's Howard. So I go by Howard at dentaltown.com, and he goes by Hogo, Hogo, at dentaltown.com. And anybody listening that would love to teach, you know, growing up Catholic, one of my favorite saints was Irish. I'm 100% Irish. Was the St. Patrick, and his 3-leaf clover. That was the prop to teach the Trinity, the Father, the Son, the Holy Spirit. And teaching is just really neat. And now the 3-leaf clover is no longer the teaching mechanism. It's these webcasts. It's a smartphone. And what's amazing is there's 2 million dentists, and I've lectured in 50 countries. 500,000 of the dentists are on desktops like we are, but 1.5 million don't economically have that desktop, but they all have a smartphone, and it's amazing. So they're watching these Dentaltown courses and dental schools all over on their Samsung or their iPhone, and you could be teaching them laser around the world. And one thing I want to go back and clear though, and again, these questions, I always try to estimate, you know, somebody's, you know, right now they're on their Stairmaster, they're on their treadmill, they're on an hour commute to work. What is the difference between an erbium laser and a CO2 laser?
Okay, it's a different wavelength. The erbium laser, most of the erbium lasers have a tip on the end. BioLase does have one called a turbo handpiece, where the tip is embedded into the handpiece, which is great for pediatric dentistry because only about 1.5 millimeters of the tip is exposed versus 4 to 6 millimeters in the child biting down. With the CO2 laser that's on the market, the Solea, there's no tip. The beam comes right out of the handpiece. You get a contra angle and a straight handpiece, and you're about anywhere from 1 inch to 2 inches away from the soft tissue or hard tissue, and you're going ahead, and they have different settings. And what's so neat now with computerization is, you know, people call me up or at a lecture and they say, gee, what settings was this, Uncle Fred? Well, I send them pictures of my presets. And you can do presets, so when you sit down, you don't have to go through 20 settings. You just say, okay, like my associate the other day, she said, well, what setting should I use? I said, for the Solea. I said, well, it's a primary molar, so you're going to put it on the dentin setting, and it'll give you all the readouts. And what's different about the Solea, different than any other laser, is that when you step on the foot pedal, that controls the wattage. Whereas the other lasers you have to control, with your finger. This way you have a foot control, almost like gas on the pedal.
So you're saying, but 3 out of 4 times you still will pick up a handpiece to refine the prep?
Yes. Yesterday I did a zirconium crown on a primary molar. So I used the laser for laser analgesia, picked up the handpiece, prepared the tooth for the crown, went back to the laser, made sure all the caries was removed, checked it with my Mirror Explorer and spoon excavator, and then seated the crown. So that's how I do it.
And interesting. And so you've talked about laser for anesthesia. You talked about laser preparing the tooth. I have a friend, and I don't want to say his name because I don't want to throw him under a bus and get caught for this, but he's a podiatrist. And he says that the secret to his very successful practice is he always advertises laser foot surgery. And he said that it doesn't really, he says, I can do it with a laser. I can do it with a scalpel and a burr. But he says the laser is profound in marketing. He says for some reason, people just would rather have the corn removed with a laser than a handpiece. Do you ever think about the marketing effects of this laser?
Yes, in fact, I'm glad you mentioned that. My previous practice that I had for 32 years, I sold it 3 years ago. And by the way, I set up a new office, renting space from a general dentist, just like I started 35 years ago. But this one's walking distance from my house, which is nice. But in any case, practice differentiation. From my office, when I had an office in Buffalo Grove for 32 years, you could walk to 5 other pediatric dentist practices. We were the only practice that had a hard tissue laser. So when the word spreads, by word of mouth, by newspaper display ads, we offer laser dentistry and so forth. And the other little trick I wanted to tell you and the listeners is, Howard, I don't know about you, but one of my pet peeves is when a parent or a teenager pulls out their cell phone while I'm trying to do a consult on them or their family. Does that bother you?
Yeah.
So here's what I did. I made a sign, and everyone listening can steal this idea. I made a sign on the computer. It says, no cell phones allowed, laser in use. Now, one of my former hygienists came down from Milwaukee. She had retired, and she says, Uncle Fred, because all my patients call me Uncle Fred. Uncle Fred, what happens if my cell phone goes off and you're using the laser? I said, Dawn, let's not find out. So in any case, and I've told parents, I looked them straight in the face. I said, Mrs. Smith, we use lasers in our office, and I'm going to have to ask you to turn off your cell phone. So, and then the glasses, from a pediatric dentist standpoint, whenever I lecture, I say to the audience, by the way, how many of you at some point in time do not want the parents in the operatory? And anywhere from a couple people to half, depending on where they went to school and their inclination, raise their hand. And I said, well, the sign is up, which legally it has to be, class 4 laser in use, danger, okay? So I say to the parents, Mr. and Mrs. Smith, I'm sorry, we don't have enough laser glasses. We'll have to let you wait outside in the reception room. And 99% of them will not even balk at that. The other day, I was treating a baby. It was Monday. We do frenectomies on the babies that are lip-tied and tongue-tied, which is something I want to talk about. And the mother said, can I stay in the room and have Dad hold the baby? And I said, I really don't have enough laser glasses for both of you. And that was true, but that's a way to get one of the parents that's a little more squeamish, perhaps, or the opposite, the domineering parent. out of the operatory.
So as a pediatric dentist, is one of the big major keys to patient management of a child is getting the parent out of the room?
No, I would say not. For example, my special needs patients, I always have the parents in. Now, some of the adult special needs that I see, like the autistic and so forth, they don't want the parents to be in. You know, they're big boys or big girls, and they say goodbye, mom and dad. And you know, one of them we did crown and bridge. He had implants done by a friend of mine, and so forth. So it just depends on the patient. But usually for special needs patients, I'll have the mother or father there because many times they help hold the hands and offer psychological and sometimes physical support.
Yeah, I'm 52 and my special needs sister is 51, and I think she likes to be independent. She's always get out. You know, everybody leave her alone. She wants to be, you know, independent, I guess.
Right.
And
Exactly.
so she's like, so I want to ask you another thing. Since you've been a pediatric dentist for 3 decades, how long did you say your practice? You'd run it for 33 years.
That practice, yes.
Yeah. You know, when I think of controversy among pediatric dentistry that you would have to deal with the consumer would be amalgam versus composite. Some of us older guys like me are, you know, end of the day, I just think amalgams last twice as long as plastic composites. But what do you think of the amalgam controversy? Because it's very loud. I would say that it feels like here in Phoenix, it's about 25% of the state is just they're up in arms about water fluoridation. You know, they don't want fluoride in the water and they don't want any amalgam in their mouth. Do you think amalgam or water fluoridation, do you think they're toxic or do you think they're good, beneficial? What are your views on water fluoridation towards pediatric decay and amalgam?
Yeah, well, let's talk about water fluoridation first. The babies under age 3, I have them use nursery water. The reason for it is there's no fluoride in that water. But after age 3, we introduce, and this is according to the American Dental Association also, we introduce fluoride, both a little bit, half a pea-size amount on the toothbrush, and fluoride water, fluoridated water.
What is nursery water?
Nursery water is bottled water that does not have fluoride.
So just reverse osmosis, just straight.
I don't know how they do it, but there's no fluoride in it.
Okay.
So all nursery water has no fluoride, so we don't have to worry about that. But
and you're saying the American Academy of Pediatric Dentistry recommends no fluoridated water till age 3?
Actually, the ADA.
The American Dental Association?
Yeah, it used to be 2, then 2.5, now 3. Okay. So as far as amalgam, I think amalgam is a wonderful, I still have some in my mouth that are 40 years old. I think it's a wonderful material to use. In certain cases, we can, in most cases, we can offer the white tooth-colored filling, resins, or amalgam. I like the amalgam for larger restorations that perhaps the patient can't afford a crown, but the amalgam's going to be stronger and last longer, I feel, than a composite. And Gordon Christensen and everyone else has shown this. Now, the other thing is, when I got back from dental boot camp many years ago with Walter
Haley.
Right, Walter Haley.
In Texas.
And Steve Anderson, right? And we divided up our practice, and half of us went one time of the year and the other half the other. When my partner at the time, George, and I came back from dental boot camp, I said, George, would you rather, if it were your child, and if it was mild to moderate caries, would you rather have a composite or an amalgam in your child's mouth? And he said a composite. So here's what we started doing. And informed consent, right? So we tell the parents, Mrs. Smith, we have 2 types of fillings. One is a silver amalgam filling. The other one is a white tooth-colored resin filling. Which would you rather have? The cost is the same. No difference in price. So the parents, 99% of the time, will say, I don't want metal in my child's mouth. I have a lot of those families. Or they'll say, yeah, let's go with the white filling. I think it'll look nicer. And of course, there are some companies, as you know, like Cosmodent, that came out with colored fillings for children called FunFill. That are composites. Now, there's a company, Voco, that has comprimers that are colored also. So I've used those for years. But here's what I do. I don't ask the child first. I say to the parent, we have colored fillings for the baby molars. If you would like, I can offer, yellow, green, blue, purple to your child. And they say, no, let's stick with the white. Fine, because I don't want to get in the middle of that fight. Okay, but informed consent, and you have something else to offer.
I want to ask you another controversial question on the message board. Some dentists, they hear patients on a pulpotomy that they don't like formicresol. That some people believe formicresol could be carcinogenic. What are your views on formicresol for a pulpotomy? And do you think it's carcinogenic?
Yeah, I appreciate you asking. In my lectures, I have research, evidence-based dentistry, where they have taken teeth that had pulpotomies and measured the level of the blood afterwards, and there was no evidence that the formicresol ever got to the blood. So, but being the type of practice I have, and the educational level of the parents, a lot of them, like I said, are holistic. I had one mother call me up, this was about 3 years ago, and she said, I know that my son's having general anesthesia with an anesthesiologist, and I know you're going to do full mouth rehabilitation, and I know he's going to need root canal treatments on those primary incisors. I don't want any formicresol in his mouth. So that's when I started to use biodentin. Biotin, of course, is for dry mouth, but biodentin Biceptodont. And Howard, I have done non-vital primary molars and anteriors with biodentin and got 80% success or higher. But here's the caveat, and that is no internal or external resorption. And the parents are willing to bring the child back in 2 weeks, 1 month, and 2 months for post-op checks. So if I'm at Loyola University doing a hospital case with my residents, and I may never see that patient again, well, if it's a non-vital tooth, that tooth's going to come out. If it's vital, we'll do a pulpotomy. So it depends on your patient population, and also I've had really good success with that biodentin. The other nice thing is I use the laser with it, and I go into the orifice with the laser. Some dentists, friends of mine, laser dentists, will go into the canals, but I do pulpotomies with the laser and pulpectomies on the anteriors of primary teeth with the laser because it's killing over 90% of the bacteria.
You're so good, and thank you so much for spending time with me. I'm just gonna keep going with even more controversial questions. On these general anesthesia cases, it's mostly just dentistry, where like an oral surgeon does the anesthesia and removes the 4 wisdom teeth. But when you go into the hospitals, they always separate those skills. They say an anesthesiologist will do the anesthesia, and the surgeon will do the surgery. And most hospitals do not let you do the anesthesia and the surgery. But you still see that common in the United States. What do you think of a pediatric dentist doing the sedation and doing the full mouth in your office versus going to a hospital and having a board certified anesthesiologist do the anesthesia and then you do the dentistry? Do you think?
I'm going to answer you in 2 ways. Number one, we have 2 dentist anesthesiologists in Chicago, Mike Higgins and Zach Maciel, that go from office to office, and they provide general anesthesia for the healthy patients, ASA 1s and 2s. And they bring all the supplies, all the emergency equipment, and so forth. But also in the state of Illinois, as in many other states, I am licensed in the state of Illinois to do conscious sedation. So I can use conscious sedation to sedate a patient, but I'm talking about, I still do quadrant technique. In 45 minutes, I don't have time to do a whole mouth. So I give the parents an alternative. If you want to try conscious sedation first, that's fine. If you want to sometimes we can just use nitrous oxide as a sedation. Sometimes we use nitrous oxide, and I like midazolam, Versed, that I use with the children. And the parents are given all the instructions and go over everything, NPO after midnight and so forth. And we've been very, very successful with that. But as Dr. Primosh taught me from University of Florida when he came up and lectured to the Illinois Academy of Pediatric Dentistry, it's 80% effective. So I tell the parents, 80% of the time, this is going to work. If it doesn't, we can have the anesthesiologist come in.
And then the anesthesiologist. Yeah, I have one of those two call. I'd like to podcast interview one of these dentist anesthesiologists.
Okay, I'll get you their names.
Yeah, there's a few programs. I know University of Oregon Health Science has a specialty program, and I know they have been fighting for there's 9 specialties by the ADA, and they've been trying to get their own specialty.
Exactly.
Have you been following that?
Yes, and Ohio State University, my alma mater, they have an anesthesia program. In fact, I went to school with the fellow who is head of the program, and that's where Dr. Messia trained, one of the 2 in Chicago.
They also, I'm living in Phoenix for 28 years. I don't know who's crazier fans, Ohio State or Nebraska, because whenever they're in a bowl game in Tempe, the whole town turns their colors. I mean, it's just like, my God, and 90% of the people that come don't even have a ticket to the game because, the stadium only holds so many people. But my God, Ohio State and Big Red football fans, they're just amazing. So so a dentist is listening to this, and he's probably hoping you put some online C courses up. But there's, to learn more also, there's your website, dentaledorg. There's also 2 associations, WCLI, ALD. Will you talk about those and what are those like? And what if a dentist was going to join one? What's the difference between the 2?
Okay, the WCLI, which is the World Clinic Laser Institute, is a BIOLASE run educational programs. So they have them throughout the world where they market and sell their lasers. Whereas the Academy of Laser Dentistry is all the laser companies, including BIOLASE, are represented. And what's neat about the workshops that Dr. Cotmo and I have been giving is we've had all the different laser companies set up so that we can go from laser to laser, and the students can try different lasers and say, gee, this one's faster, this one's slower, I like the handpiece better on this one, and so forth and so on.
You know what I actually like most about the lasers, and this is kind of off the wall, but in all honesty, is humans they burn out, they long careers, they fry, and when you trade time for money, it leads to disease and depression and alcoholism and substance abuse. And what I like the most about the lasers is it just seems like if a dentist buys a toy and it makes them run 30 red lights on the way to work and get speeding tickets going to work. And they'll say to me, like, the people come up to me and say, do you think I should get a laser? And I always ask them the same question. He goes, well, not what would you do with it, but well, what do you think? And if they just sit there and go, man, I just think it'd be really, really cool. I'm like, then you have to get a laser, because you don't want to sit there and go into work and be bored. I know, always remember my 4 boys, if you go put them in the sandbox or the swimming pool with no toys, they're out in 10 minutes. But you put them in the sandbox and you throw in the Tonka trucks and the pails and the shovels and all the toys and a garden hose with water, and my God, we'd be out there for 6 hours. Same thing with the swimming pool. Even a bathtub. The more toys, the more fun it was. And my gosh, I tell dentists, don't look at the price. If you think it's really cool and you think it would be fun, well, that's going to be a 10-time investment. Think about the dentist who burns out and sells their practice and becomes an alcoholic versus the one who loves going to work and stays in it until the day they die. And when you look at the titans who built America, whether it be Rockefeller or Carnegie or Ford or any of these guys, they all worked 80-hour weeks until they dropped dead in their late 70s, 80s. I mean, Rockefeller was 96. These guys, Sam Walton was found dead at his desk. France's President Mitterrand was found dead at his desk. I mean, these guys loved what they were doing until the last day. So I think lasers are, like say psychology, human. If you love them, and then the marketing, the unique selling proposition to be a laser dentist, that's just huge.
Howard, excuse me. I wanted to get this thought out because this is exactly what you're stating. When I write my articles on laser dentistry, one of the things I emphasize is avoiding burnout. We had a laser dentist come from Indiana to take my certification course a couple years ago. And he walked in and he said, Dr. Margolis, lasers have revolutionized my practice. And I'm sure it's revolutionized him also. And, I get wonderful emails. Oh, I did, 10 frenectomies and 4 quadrants of dentistry. See, the other nice thing is because the patient doesn't have the numb feeling, you can do multi-quadrants. So even though the laser costs more than the injection of local anesthetic, you can still sit there and do many quadrants and immediately. You don't have to wait 3 minutes or 10 minutes or whatever.
Last year, I had the most interesting guest in my seminar before. This dentist came up to me, and he was old. He was 92, and he was actually an Auschwitz survivor and from Poland. And I said, you're still practicing at 92? And guess what he said to me? He goes, when I turned 85, I thought, I should retire. But then I upgraded my 2D pano to 3D cone beam and started doing surgical guide and implants. And I'd never placed an implant before. And it's so damn fun. Here it is 7 years past he was going to retire at 85. And now he's 92. And I said, how many implants do you place a month? And he goes, not a lot, maybe 25 or 30. And I'm like, oh my God, this guy's 92. And he's in the top 1 percentile of placing implants. And I mean, he was so on fire. I think listening to him, and I had lunch with him, he probably got tired of all the fillings, the crowns, everything he'd been doing forever. But what was totally new to him now was 3D x-rays, surgical guided implants. He'd never done it. So he was like a little boy again, and he was just playing. And my God, I don't think anybody in the room was having more fun in dentistry than a 92-year-old man. I mean, just so that's very important. So another thing I want to talk about on these certifications, Uncle Fred, is that something you do because it's a legal state mandatory thing, or is this something that you recommend and getting certified?
Every state has their own, obviously, dental practice acts. Let me give you an example. We had a laser dentist, pediatric laser dentist, come from Las Vegas. And in Nevada, the Dental Practice Act says that you have to be certified according to the Academy of Laser Dentistry certification process in order to use your laser. So she bought her laser. It sat in the closet from October till March when she came and took my laser course, certification course, and then could take it out of the box and start using it. So every state has its own requirement. In Illinois, for example, hygienists can use a laser for non-surgical, as I mentioned, and I fly in, every November, I fly in a hygienist who teaches the Academy of Laser Dentistry, and she's in a general dental practice, but she teaches the hygiene portion of the diode lasers while I do the hands-on with the dentist for the diode. So you have to check with the state, or let me give you and the listeners the website for the Academy of Laser Dentistry, which is laserdentistry.org. Very easy. And you can ask them which states are covered as far as the certification.
You're talking about lasers, and you just mentioned hygienists, so you have to finish the story. Everybody's hearing about perio and lenap. Can you talk about lenap? What do you think? Can you explain what lenap is, and then tell us what your opinion is of it?
Okay. Lenap is a technique for the reattachment of the gingival tissue, the attached gingiva, to the surface of the tooth. Lenap is owned by, that phrase or acronym is owned by a company called Millennium. They have a wonderful laser, but many periodontists tell me that they can do the lenap procedure without having that particular laser. Now,
is it an erbium laser? Or
no, it's actually an Nd:YAG.
An Nd:YAG, okay.
Yeah, Nd:YAG. So it's 1064 nanometers. Now, I don't want you and I to get sued, so I will just say that the hearsay is that you can do lenap procedures without having a Millennium. And the dentist would have to do their own. Yeah.
But does the Millennium laser work? I mean, if you did lenap and you used the Millennium labor and erbium YAG, you said, but do your periodontist friends think it does work though? I mean, is that a viable treatment?
Yes. In fact, I have a general dentist who's a member of our dental fraternity, and she came and took my introductory course, and then she went to Millennium and took their full course on lenap procedures, and she swears by it. In fact, I think she teaches for them now. So it is viable. It is a real procedure, and it does work.
You know why I'm not a member of any dental fraternities?
No.
Because I would never join a fraternity that would accept me as a member. Old Rodney Dangerfield joke, right? He said he would never join a country club that would take him as a member. So we're down to 3 minutes. So what would your close be? I want your close to be to talk about your dentaledorg. Tell us if a dentist wanted to learn more, what is this dentist? She's driving to work right now. If she goes back to her office and logs on to dentaledorg, what's on that website? What is she going to see, and how's she going to learn more about lasers on dentaledorg?
Okay, well, first of all, it'll offer under webcasts, it'll offer the webcasts we've done. All of them but one so far have been free. The one that wasn't free is $59, and that was sponsored last month by the Ontario Academy of General Dentistry. They're on various subjects, anywhere from cosmetic dentistry, and it has nothing to do with lasers, to implants, to we had a PhD in biomaterials as a speaker, as a webcast presenter, and I've given several of them myself on different areas of pediatric dentistry. And then we also have all my publications. You can download in a PDF file. For example, I put my newest article that you were nice enough to have published, thank you, on Class 2 composites, and that's now on there. So anyone can go there and see the references and learn more about that particular subject. We also have courses and the course schedule of where I'm going to be in the next year lecturing, and how they can find more about us. We also have books and DVDs. We have DVDs on the laser procedures we just talked about that I had professionally made. And
now, if a dentist wanted to get certified, can he just fly to Uncle Fred's office in Chicago?
Yes.
Or do you recommend you go to their office?
No, they come here.
They come there?
Because some of the lasers I can't transport. They're so big.
Right. And is that a 3-hour program, a 1 day, a 2 day? How long does it take to get certified?
The introductory course that's recommended by the Academy of Laser Dentistry is 3 hours minimal. So I give a 3-day course, a 3-hour course as an intro course, but they can bypass that by reading articles that I will assign them on laser dentistry, and then take the 12-hour certification course. That's the minimum, 12 hours. So what we do is we do an all-day Friday and half a day Saturday, and they can fly home Saturday afternoon or spend the weekend in Chicago.
And how many Chicago-style hot dogs do you get to eat during that course?
As many as you want.
Because when I think of Chicago, I just think of their Chicago-style hot dogs. I also love the debate whenever you go into a Chicago pizzeria or a New York pizzeria, and how those guys are playing for blood on who has the best pizza, Chicago or New York.
Right.
But so that was just an amazing hour, and So so I only got you for 20 more seconds. So just your final close. Why should this lady driving to work right now buy a laser? She's a general dentist in Oklahoma City, and she got out of dental school 5 years ago. She's 30 years old. Why should she get into lasers?
All right. Number one, practice differentiation, i.e. marketing. Number two, avoid burnout. Number three, no trauma psychologically on our part, because we can use the laser for laser analgesia. Number four, greater earnings. When I started using the laser, we started charging more for hard tissue cavity preparation. It was that or raise my fee. But if I raise my fee, then it's not competitive with the others. So we have a sheet that we hand out explaining the laser, and it is not covered by insurance. And we would charge a nominal fee per appointment for use of the laser for hard tissue. For soft tissue, Howard, I've been a laser dentist now for almost 15 years. I've never had to place a perio pack. Once in a while, if I'm doing a deep mucocele or ranula excision, I'll put in a suture, but that's very rare. So, saves time, saves money, earns money, more fun. And I want to close by telling you that the mothers that have the babies that can't nurse or take a bottle because they're lip tied or tongue tied, in 3 minutes, the procedure's done, little or no bleeding, and they can breastfeed right away. So that's another way to grow your practice.
That was an awesome close, and I want to throw in a close for me. And my close is that in my journey, got out of school in 87. It was 1998. I was having these arguments with some of my dental friends in my zip code that electrosurges cause a lot of post-operative discomfort. And they were saying that they never experienced that. So I kept thinking I was doing the electrosurge wrong. I needed more water, different settings. I bought another electrosurge, a different type, because my friend had a different type, and I kept getting it. So one day I was picking him up for lunch, and I was telling him that in his waiting room, and his receptionist says, well, we get a ton of post-operative symptoms. We get a ton. They're always calling for refills on their pain meds. But by the time that dentist saw him 2 weeks later for a crown seat, it had stopped. And what I realized the problem was that the receptionist, when a patient's calling, they didn't have time to go pull a chart and make an entry. That Fred called and said that tissue you burned off the electrosurge was hurt like hell and wanted to know if he can get a refill on his pain med or anything like that. So I went back and thought, I wonder how many conversations are not being entered at the receptionist. And I had told him from 87 to 99, every time a patient calls, you have to pull the chart and enter the note. Because when I see this patient again, I need to see what's going on. And logistically, it just couldn't happen. And so the only way I solved it in 1999, I threw out all my charts and went paperless. Because if Fred Margolis called up, I can just enter Fred Margolis, then I can enter the note. And I realized it was so crucial to digitally capture these ongoing communications, because my outstanding dentist friends with great hearts and minds and souls just absolutely were oblivious that this was an issue, because nobody was pulling a chart and saying, hey, that guy you did, that hurts like hell. That was a lot of pain. So on that note, we are out of time. Fred, it was an honor that you spent an hour with me. You're a legendary career. Congratulations on your award. And I hope to see you put up a course someday on Dental Town, or start a post with your handouts or whatever. That would be amazing.
Well, that would be my pleasure. And thank you, Howard, for your time and efforts.
All right. Have a great day.
You too.
Bye-bye.